Hi guys, so today my presentation is going to be on myocardial infarction, also known as a heart attack. So I will be discussing the pathology slash etiology, the process of the medical diagnosis, some common pharmacology, as well as the prognosis for recovery, physical therapy treatment, including any precautions and red flags. Okay, so for etiology, myocardial infarction is also known as a heart attack, and it occurs when the flow of blood to the heart is blocked or reduced. This could be due to a buildup of fat in the coronary arteries, which is also known as atherosclerosis, which is the buildup of plaque. And then that piece of plaque breaks off and then lodges into one of the coronary arteries, which causes the blood to be blocked or reduced. So, when you have that blockage and there's a deprivation of oxygen supply to the myocardium, which is the heart muscle, that can lead to cell death and necrosis. So, some signs and symptoms of a myocardial infarction range from chest pain to upper extremity pain, even mandibular or epigastric discomfort that can occur when a patient is exacerbating themselves or even at rest. They can also present with dyspnea and fatigue. And then that chest pain is usually retrosternal, and sometimes people say that it describes as someone sitting on their chest, so lots of pressure and heaviness. And then even times that pain can radiate down towards the left shoulder, neck, and arm. So for some common pharmacology that are given when a patient has experienced a myocardial infarction is aspirin, and aspirin is used to reduce those blood clots. And then there's also clot busters, which are known as thrombolytics and fibrolytics, and these help break up any clots that are blocking that blood flow to the heart. There's also medication called heparin, which makes the blood less thick and then therefore less likely to form clots. There is nitroglycerin. This one is given right away when a patient is experiencing that sudden chest pain. Morphine is a pain medication that also helps relieve the chest pain if it doesn't go away when they give the nitroglycerin. There's also called beta blockers, which slow down the heart rate and decrease blood pressure because it can limit the amount of heart muscle damage and prevent future heart attacks. There's also angiotensin converting enzyme inhibitors, which lower blood pressure and reduce stress on the heart. And there's also statins, which lowers the bad cholesterol, which can clog arteries. Okay, and there are different ways to diagnose a myocardial infarction. For example, if a patient goes to the ER and is presented with chest pain, they'll automatically do an electrocardiogram, which is an EKG or ECG. They will also run blood tests to see if the levels of troponin are elevated, which indicate a myocardial infarction. Also, a chest x ray, an echocardiogram, an angiogram, and then CT or MRI. Okay, so prognosis after an acute myocardial infarction. So, despite all these advances in treatment and in medicine, after an acute MI, the mortality rate is between 5 and 30%. And then most deaths occur before hospital arrival, so before they're getting any treatment. And that prognosis depends on the extent of how much that heart muscle was damaged due to the blockage and the deprivation of oxygen. It also depends on the ejection fraction, so how much blood is getting pumped out of that left ventricle, and then how much function that left ventricle has altogether. And then 1 year post MI mortality is still at about 5 to 12%, and this can be usually due to other comorbidities such as diabetes, such as being a little bit on the older side, so advanced age, delayed reperfusion of the, the heart, the blood, low ejection fraction, so the amount of blood being ejected from the left ventricle is a lot lower, congestive heart failure, elevated C reactive protein, a high B type peptide, and also depression. So, for physical therapy implications, from the research I saw, a lot of patients that suffer from a heart attack will go through something called cardiac rehabilitation. And this is usually done inpatient or even in the hospital on an actual cardiac unit. So, cardiac rehab is medically supervised program from doctors, nurses, PAs, nutritionists, dietitians, respiratory therapists, kind of everyone on the whole healthcare team. And it's designed to improve cardiovascular health in those who have experienced a heart attack, heart failure, an angioplasty, or even a heart surgery. So, cardiac rehab involves improvement through endurance training, health education on proper diet, and lifestyle modifications. So, the most important goal of cardiac rehabilitation is to reduce mortality and morbidity in patients with cardiovascular diseases. So, there are many precautions when you are going to be treating someone who has suffered from a heart attack, any type of cardiovascular disease, any type of cardiac surgery. So it's important to monitor vitals before, during, and after a physical therapy session, which include their heart rate, their blood pressure, their oxygen saturation, and their respiratory rate. And it's also too important to know what their vital signs, where they run in their vital signs. So definitely looking back at the chart to see the ranges of their blood pressure, if their heart rate, and then if they're on oxygen, if the nasal cannula is through the nose. And then it's also important to give long rest periods in between exercises. So making sure the patient has enough time to bring their heart rate down, get their blood pressure down, have them catch their breath in between exercises, in between any gait training, any sit to stand transfers, because they're most likely still going to be in the hospital. And then also educating the patient to be aware of the signs to stop activity. So we know signs is something that we can see as a clinician, but symptoms is what the patient feels themselves. So educating them to when they feel a symptom such as shortness of breath, dizziness, nausea, vomiting, chest pain, anything along that line, to let the clinician know so that way they can stop treatment and have them take a seat, recheck vitals, and grab the nurse or the doctor on call. And then also for avoiding extreme temperatures, this is kind of more towards when the patient is close to discharging to home. So when they're continuing their physical therapy at home, avoiding doing their exercises in extreme temperatures or when it's kind of really hot outside, making sure they're in a air conditioned room. That way they don't exacerbate themselves too quickly. And then this is the research study that I found for cardiac rehabilitation and how it relates to physical performance in patients after a myocardial infarction. So, with this study, there was a group of about 126 patients, and they each had suffered a myocardial infarction within a year. So these patients were placed, there was 3 different types of exercise models, and they were all initially assessed for their physical performance. The physical performance included an exercise stress test, the time for that, an exercise stress test, MET, a 6-minute walk test that was 30 meters, and also measured their VO2 max. So the purpose of this study was done to assess their physical performance in patients after myocardial infarction before and after cardiac rehabilitation in 2 stages of operation. So the first stage was 3 months after their myocardial infarction, and then again, they assessed their performance 6 months after myocardial infarction. So the results with this showed that the increase in physical performance during cardiac rehabilitation was 14.4%, as opposed to the patients who did not have that cardiac rehabilitation, their physical performance only went up 5%. So that's a big difference, about double the number of patients who saw an increase in their VO2 max, their 6-minute walk test, their exercise stress test after completing cardiac rehabilitation for 3 months and then 6 months versus the patients who did not have cardiac rehabilitation at all, which was they only improved their physical performance 5%. So we see that physical performance is really important during cardiac rehabilitation to reduce the morbidity and the mortality rates of patients experiencing a heart attack or any cardiovascular diseases. And these are my references. The first one is for my study done, and the second two are just for the general pathology of a heart attack. Thank you.